What's up, guys? Alexander from Strength of Saad here. We're going to do a scientific analysis of a variety of clinical studies to answer the question, especially for my Australian brothers and sisters who now have access to the Moderna vaccine. If you have access to this, you're asking yourself, if you haven't already gotten it, am I going to get Moderna or am I going to get Pfizer? What is the efficacy differences? And then how do we make a decision of what is better for us individually, then based on a risk analysis of adverse events from Pfizer compared to Moderna? You see, this is a question I've been trying to answer for myself for some time now, and I just couldn't find any really recent studies that answered this question. So what I have done is as a scientist, I've gone ahead and broken it down, summarized it, and we're going to go over it now. But we're going to go over first the efficacy differences, because this is a changing landscape now with the most prevalent variant being Delta. The efficacy differences or efficacy has changed across these different vaccines. What's more efficacious, number one? This question to me is a lot easier to answer, okay? This one, based on the multiple clinical studies that we have, appears, just like TLDR, Moderna appears to be considerably more efficacious over the long term against the Delta variant. However, compared to the Alpha variant, they stack up pretty similar. But we're comparing a variant that's not as predominant anymore, it's not as relevant. So let's dig into it a little bit. So we have an August 2021 study. All the titles are there. You can look them up if you would like to vet them yourself. But I've gone in there, summarized it. Moderna vaccine was between 81 to 91% effective against the Delta variant, compared to the Pfizer, which was between 69 and 81% effective. There's a between because there's a confidence interval. A confidence interval, we are 95% sure that the data within this range we are confident in and is not due to chance. That's good. So both of them obviously effective, but if you're somebody who wants to minimize the risk and take a vaccine, okay, well, here's a consideration number one on the efficacy in protection against actually getting it. Moderna vaccine showing 81 to 97% efficacy, and the Pfizer showing 73 to 93% efficacy against preventing hospitalization. You see, we have different endpoints here. We have getting a virus endpoint, we have hospitalization endpoint, we have mortality endpoint, we have severity of illness endpoint, we have long-term symptom reduction endpoint. We have a lot of different endpoints here, which is why you're going to see us use a lot of different statistics and ranges, because it depends on what we're measuring. So now, by July, the total effectiveness, so this is sometime after, I can't recall the exact date it began. By July, the total effectiveness in preventing infection decreased to 76% for the Moderna and 42% for Pfizer, indicating a loss of efficacy over time as variants become more common. So over time now, you can expect a waning. We understand this. There is a general waning of antibody response. However, we still have memory T cells and memory B cells to mount a response against a viral pathogen. Okay, that still exists. However, there is a waning. Okay, it is not as effective. And so over time, this is an important consideration. It's like 42%, 76%. That's a pretty considerable difference that you may want to take into consideration. The authors compared vaccine effectiveness across multiple states over the entire study period. In most states, the Moderna vaccine was around twice as effective in preventing breakthrough infections. Breakthrough infections meaning getting an infection for those who already have a vaccine. This is possible. We see this. Just because you have a vaccine does not mean you can't get a virus. I don't understand where this began. Vaccine does not confer, vaccines, or this vaccine in particular, does not confer, I think the definition of immunity has been a bit bastardized. Immunity doesn't necessarily define complete protection. It is a reduction in risk across multiple different endpoints. So let's go on. So, okay, cool. Moderna is about twice as protective, at least compared to this August. Let's have a look. That's not the actual study. Compared to this August study. Now, could difference in dose play an important role in effectiveness of mRNA vaccines. Why is this occurring? Well, several factors contribute to the observed differences in the effectiveness of these different vaccines. They're both mRNA. They're both a perfusion-stabilized SARS-CoV-2 spike protein. There are slight differences in like the formation, like if you think about like a DNA sequence, like the coding, like the letter formation is a little bit different. However, it's like they equal the same thing. It's like 1 + 1 = 2, but also, 0.5 plus 1.5 = 2. So it's like we get the similar outcome or same outcome and immunity. We just get there a different way. It's kind of a really loose analogy to describe some of the differences between like Pfizer and Moderna. But most relevant is the dosage. 100 micrograms Moderna versus Pfizer being 30. So Moderna having around 3 times the amount. So of course, can we expect to see higher adverse events? Well, we're going to dig into that a little bit later. But it potentially is a pretty obvious and common sense, like, oh, that makes sense, reason why. Assuming similar size constructs, this means that each mRNA dose of the Moderna provides 3 times more mRNA copies of the spike protein compared to Pfizer, which could result in more effective priming of the immune system. There has not been a head-to-head comparison, however, of the neutralizing antibody titers elicited by the Pfizer versus Moderna. So, again, we have different endpoints of immunity. There's all different, there's B cells, T cells, there's antibody responses, the neutralizing antibodies. I'm not going to go into all the differences right now, but in totality, on average, that is where you're talking about with these difference between 76 and 42% over, I believe it was a 6-month-ish time period waning, okay? Another study here, Pfizer and AstraZeneca, okay? We didn't see as large a differences here in effective against Delta variant. So one dose is clearly, so one dose of the BNT, the Pfizer versus the AstraZeneca, and AstraZeneca, you guys can think of that's your classic adenovirus vaccine for my Americans who would get the Janssen and Janssen vaccine. Was that a good American accent? My man. My Americans. I got love for all of you guys. We're all friends. So we see that Janssen, it doesn't give you much protection if you just have one, okay? That's most vaccines anyway. We know Pfizer's like 50% if you just get one, but okay, cool. 2 doses of the Pfizer was 93% protective amongst people with the Alpha, about 88% protective against people with who got the Delta, okay? Not as large of a difference compared to the above study, but it waned over time. AstraZeneca clearly, throughout the totality of the last year of vaccines, has consistently shown up to be less efficacious, okay? But you may only be able to get that if you're in a certain cohort, okay? And so that's what you got to deal with. 74% protection is still relatively high, so take that into consideration if you will. Do with what you will with that. And then Alpha variant having 2 doses was 74% protective, and then 67% protective against those with the Delta variant. Okay, cool. Tick. I don't want to sit on these studies too long. I just want to give you a totality of the evidence. I'm a big fan. You're going to hear me say that a lot. I'm a totality guy. I want to see the average, not one study. I want to see where all these studies are pointing. Are they all muddled up everywhere, or are they pointing in a certain direction where we can make a somewhat confident assertion? That would be nice. All right. Effectiveness of COVID-19 vaccines against the Delta variants. One dose is clearly less effective. With the Pfizer, 2 doses, 93% among persons with the Alpha variant, and then 85 to 90% among people with the Delta variant. Once again, showing another consistent study of similar results. Now, efficacy across hospitalization, though. Let's partition out the differences in a really nice table format. Thank you, Dr. Roger Schwelt, for making this. I pulled this straight from him. If you want to hear a doctor, I know some of you asking, are you a doctor? I am not a doctor. I am a scientist with a background in exercise physiology, nutrition science, and a bit of biochemistry. So I'm just out here trying to seek the closest thing to the truth and speak to you guys like an actual human being, because there's a lot of there's a lot of people, you just can't understand them. They're just speaking above you. They're not relatable. I just want to be able to talk to some of you guys and I'm trying to give you the straight dope. I'm just trying to show you guys like, okay, I don't care what the answer is. I just want to know where we're at. And I have an obsession with science and information and education, and finding the closest thing to the truth is a very important value to me. And so if that resonates with you, maybe you like that. If you only want to listen to doctors and epidemiologists and virologists, then you should not listen to me, because I am none of those things. Anyway, we will continue. So what we saw, very interesting, but not unsurprising, because hospitalization, so we have 18 plus, they got, let's back up, 32,000 medical encounters, 187 hospitals, 222 emergency room care, 9 USA states. That's kind of the sample size we're doing here. From June to August 2021, when Delta was at least 50% of the variants they were seeing. What they did is they got all these patients who had COVID-like symptoms. Then what they did is they tested them, whether they had COVID or not. Then in the bracket, you can see, all right, unvaccinated, 18.9% of the people with COVID-like symptoms tested positive, versus fully vaccinated, 3.1%. So there was an 86% reduction in risk of hospitalization for those who were fully vaccinated. 3.1% of this cohort versus 18.9%, totaling a reduction in risk of 86%. And then we see hospitalizations across different age groups. We see a waning of this with the 75 and older category, but still somewhat efficacious, 76%. So reducing hospitalizations is a really important outcome. It's not just about mortality. It's not just about morbidity. It's about whether you take up a hospital bed that could otherwise be used for somebody else. And this becomes particularly relevant when ICU beds are at capacity, because then elective surgeries have to be pushed forward, because then people who need cancer surgeries, radiotherapy, chemotherapy, musculoskeletal ailments and injuries that could really improve someone's quality of life, they need to be triaged and then pushed forward according to their level of, severity. And so this isn't a point that I've really thought about that much, but that's one reason that point is important, is because while fortunately you might be in a state where that hasn't had that happen yet. We've seen it happen before though, and until it happens in front of you, to your state or to someone maybe we won't really care, but with a particularly emotive, powerful enough story or education, perhaps we can illuminate the idea that, well, it does matter. Hospitalizations do matter. I have things to do. I don't want to end up in a hospital. I assume people listening don't want to end up in a hospital. So I'm going to do the things to help mitigate me ending up in one. Because I'm a busy guy. I like life. And life, for me, does not involve trying to minimize the time in hospital beds as long as possible. That's what I've learned about life. Vaccine type efficacy against getting COVID-19. Once again, now we break it down for the vaccine type. Pfizer, 77% against getting COVID, and this was the Delta variant specific. Moderna, 92%. I like that. That's looking good for Moderna. If there was a horse race, Moderna is ahead in the efficacy race. And then Janssen, 65%. Janssen came last, got the bronze medal. Sorry, Janssen. You weren't taking enough steroids. You needed to contact Russia. So, it appears to be Moderna is more efficacious. Why? Probably because you get 3 times the amount of mRNA copies. The dose makes the poison, and the dose makes the benefit of the medicine. And then again, seeing it in hospitalizations, Moderna, once again, stacking up to be 95% efficacious compared to people who are unvaccinated, 80 for Pfizer%, and then 60 for the Janssen. And so that covers the first 15 minutes of vaccine efficacy. Now, in part 2, we are going to go over to the side effects. This is what you came here for, right? Yeah, this is the stuff where I've really been trying to dig in and understand, because I couldn't really get an answer. adverse events of Moderna versus Pfizer, I know Moderna's more efficacious, so shouldn't I get it? Well, it depends your risk tolerance for side effects, adverse events. Are you willing to take the lower efficacy and protection of Pfizer if Moderna had a measurably increased risk of adverse events? How much would it have to be higher for you to consider Pfizer over Moderna or Moderna over Pfizer? Well, let's talk about it. All right. So, guess what, guys? There are adverse events with everything. Okay? Everything. And when you have enough of a population getting a vaccine, like billions of people right now, which is absolutely staggering and mind-boggling, you're going to see the rarest of the rare. And that's good for us to know. We want to know that because that's someone's life. And no one wants to experience that if they can. And if we can mitigate it, let's do that. And if somehow we're wrong and we have underreported side effects, let's fix that up. Because maybe there is some underreporting there. Some people think there is a lot of underreporting. That's another conversation for another day. But let's even consider that there is. Put maybe a 20% buffer on all these adverse events and then compare them to the adverse events of COVID, and you can make your own mind up. But your mind changes, right? Because new information comes out, better information, perhaps, and we change our mind. You have to be adaptable, like Play-Doh. Is Play-Doh adaptable? Play-Doh is very moldable. So, enough about Play-Doh. mRNA vaccines to prevent COVID disease. So Pfizer appears to be, TLDR, appears to be, have less adverse events. Okay, there's a variety of different studies. I'm going to go down to the best one that I found, the best two I found in a second. But severe symptomatic events, this was December 2020, so like nearly a year ago, were reported in less than 2% of Pfizer vaccine recipients after either dose, except for 3.8% reporting fatigue, 2% reporting headache. So these are these acute effects. So for this study, it was sitting somewhere between 2 to 3%. Okay. Yes, you can also have reactions to inactive ingredients. There's Pfizer, BioNTech, and Moderna vaccines are not formulated with any food, drugs, or latex, but both contain excipitant PEG for the purpose of stabilizing lipid nanoparticles containing mRNA. The specific PEG in these vaccines is different from the PEG used most commonly in other healthcare products, both in molecular weight and due to its conformation as a stabilizing proportion of a liposome. AstraZeneca, Johnson & Johnson vaccines currently in development do not contain PEG, but instead contain polysorbate. So basically, what the hell did I just say? There can be rare reactions that we will see and maybe somebody watching will experience from these ingredients, okay? This is why if you have a autoimmune condition, a tendency to react to vaccines, that is a contraindication for all vaccines. And you have a different risk profile. You see, guys, there's context, there's nuance, there's gray area. All this saying black and white. Everybody wants to paint it black and white, but there's a lot of gray. I've been making videos on this since it began in January in 2020. You can go back on my other channel, Alexander Manuel Sandals, and you will see, you think would come up to just some like consensus, but there's so much out there, and it can be overwhelming. So let me quell the overwhelm, okay? I'll do my best. I'm trying. So we saw this report from Reuters, August 2021. They looked at Guillain-Barré syndrome from the Janssen administration per million doses. And yeah, like you can look at the data and you see like per million GBS is pretty low, right? It's higher in males. It's pretty low. It's fine. Okay. It's like, it's real people experiencing it. It's not to be dismissed, but it's nothing like, you're really probably going to freak out about. All right, but let's keep going. We look at Pfizer. We look at thrombotic events. That's important. And again, we understand some of the limitations of the VS system. We're just trying to aggregate the data a little bit here and just see roughly where the data could be pointing, just to get like a general understanding of what's going on from just a raw statistical standpoint. That's not awesome statistics, to be honest, with the VS system, but let's get some idea. So basically they aggregated the data and they tried to estimate how many outcomes of COVID-19 cases and hospitalizations and ICU admissions could have been prevented, hence those numbers here. But instead, you know, I'm not gonna put too much stock in that. We're gonna spend probably a bit more time in the clinical studies, but just to give you guys an idea of like, okay, like that's a lot of people, like 13 million doses they looked at on the VAERS system, and they saw, you know, like total 7.8 GBS per million. Okay, cool, but it is an adenovirus. The Janssen or the AstraZeneca, so not everybody's going to take that, so let's get to the real money. The real money right here. Okay. So, the majority of adverse events from Moderna vs. Pfizer were mild or moderate in severity. Grade 3 severe events greater than or equal to 2% in frequency after the first dose included injection site pain, 2.7% after the second dose, fatigue, myalgia, 8.9%, arthralgia, that's like, we're talking like muscle pain, headache, pain, arrhythmia, redness, injection site. Like, this is all the acute, like, low-grade stuff that we're not that concerned about. It's going to pass pretty quickly for most people, okay? But now, let's get to the money. This is the first study that really highlighted to me how actually the majority of people getting the Moderna vaccine by the second dose experienced some type of adverse event. And I was like, man, I'd rather that didn't happen because the Moderna was looking really efficacious. But the data is better than my feelings. Data beats feelings, okay? Data can be corrupted. Data can be misinterpreted. Data can be incorrect, of course. But generally, on average, this seems to be where the data is pointing. So let's understand it. Grade 1, grade 2, grade 3 adverse events. Grade 1 is mild, generally not bothersome. Grade 2, bothersome, may interfere with doing some activities, but not particularly dangerous. Grade 3, serious. Can interfere with a person's ability to do basic motor control things like walk, eat. Grade 4, severe enough to require hospitalization. Grade 5, well, I should just write dead because you're dead. Grade 5 is fatal. It's the worst. So, we looked at 3 grades. I don't know why they didn't look at grade 4 and 5. Maybe they didn't exist. Maybe they did and they didn't record it. I don't know. However, the red is the worst. It's grade 3. What's the worst here? You don't want grade 3 because then you're not be able to do your day-to-day tasks very well. So, placebo dose 2. Fuck, placebo's crazy because look at all these people still reacting to a placebo dose. They noceboed themselves with a placebo dose. Then we see the 1273 means Moderna. It's another name for it. Moderna dose 1. Any adverse event, we looked at around 80% are experiencing any adverse event, and a bit higher. It's more like 77% versus around 82% for the second dose. And then we break it down into different categories, which you could pause the video and look at. What we see is local events, like acutely at like a particular site, swelling, lymph swelling of your lymph nodes, arrhythmia, pain. But then we come over to the systemic events, which are more annoying, more serious. Fever, headache, fatigue, myalgia, arthralgia, nausea, vomiting, chills. And so what we see is that, you know, let's look at some of the most significant ones here. Majority of people here from getting the Moderna are experiencing some sort of adverse event. But it's a scale, right? And it does resolve generally within 3 to 5 days. If you're lucky enough in the 20% to not get any, awesome, okay? However, like, let's put into consideration that these are some of the things you may experience. They all have their own unique relative risk differences. Some of the highest ones are headache across the second dose, fatigue, myalgia, chills, and then pain in the local events. Pain could be injection site pain. Okay, it's not specific to injection site pain. It's not specific to like a different area, to my understanding. So this is within 7 days, by the way, recorded. So that is what we're potentially approximately dealing with the Moderna vaccine. Okay, now, and then they come over here and we just, nice little summary PDF here. 30,000 participants, 18 years and older. This was the normal 28 days apart from vaccine. 100 microgram dose, all some of the standard stuff. Most reactions were mild to moderate and resolved over 1 to 3 days. So great, you can expect yourself to resolve this cytokine inflammatory response within 1 to 3 days. Cool, that's nice. But let's still be aware that there are some adverse events that can, have a bit more of a deleterious effect that you'd rather not experience. So injection site adverse events after first dose, so 84%. That's fine. A little bit of pain in your arm. That's whatever, right? However, systemic adverse events after the second dose was like 80%. That systemic one was what we're talking about here. And so that could be anything. Fever was relatively rare, particularly, first dose doesn't seem to be almost any. What seemed to be the most prevalent was that headache, fatigue, myalgia type of events. So plan ahead for that. Don't nocebo yourself. You might be the 20%, the 30%. Like that could be you. It's somebody. Why not you? Anecdotally, what I'm starting to notice is potentially more of the unhealthy cohort with people with unhealthy lifestyle risk factors appear to be, this is not a study, by the way, this is my observation, my anecdotal experience, people who are generally unhealthier, sleep deprived, nutrient deficiencies, overweight, obese, poor immune system function, generally seem to be responding a little bit poorer on average at a high risk for adverse events. I believe that would make a lot of mechanistic sense to me. I don't have clinical evidence to back it up though. So, in summary, the severity of the solicited systemic events increased after the second dose of the mRNA Moderna vaccine, with an increased proportion of grade 2 events from 16.5% after the first dose to 38% after the second dose. Grade 3 events, though, this is where you can get knocked out for a couple of days. You're not really doing much. You're kind of bedridden. We went from 2.9% from first dose to 15 or 16% after the second dose. Solicited systemic adverse events in the mRNA group lasted on average 2.6 days and 3.1 days after the first and second doses. So you can take this information and then you can go compare that to many of the other videos I've made and many other much smarter people than me have made on COVID-related adverse events and long-haul symptoms, and you can compare the two. And you can say, which one would I rather? Because the reality of the situation is, in my estimated opinion, majority of people across the world will get COVID at some point within the next 5 to 10 years. That appears very clear to me. I won't dig into the nuances of why, but let's assume that that's approximately true. Well, then you really have two options. You're either going to have the antibodies from a vaccine giving you some protection, or you're going to rely simply on innate immunity. Again, it is of my opinion that each individual should choose what to put in their body. It's your body, and I think we should govern individually what we put into it. However, we should base these decisions based on informed consent, solid education, scientific rigor, and logical, rationale, unemotive type of critical thinking. And I will do my best to continue to do that. Now, I still try to look at a head-to-head comparison because this doesn't compare to Pfizer. You kind of have to, it's not a head-to-head comparison, which is bothersome to me because I can't make direct comparisons here fairly, reliably from this to scrolling up to the Pfizer because it's comparing different outcomes. So you're like, okay, it appears like Moderna does have some increased adverse events, but how much? Well, I can't see any other studies. If anybody else has them, please send them to me. I'm sure new ones will come out after this video is made. February 2021. You see, this one was February 2021. That's the earliest I'm seeing these adverse event studies head-to-head comparison. I don't know why there haven't been more. Anyway, what we're seeing is, I don't know why this says 50 micrograms. This is a nice little comparison of the characteristics of Moderna versus Pfizer. Okay, efficacy different. Okay, we need to also acknowledge mechanism of action pretty similar. We also need to acknowledge the transportation of this is quite difficult. Both need to be stored at very cold temperatures. The Pfizer at much colder temperatures, requiring specialized refrigeration units. And this now is, I know this is not the purpose of the video, but just let's put some compassion, empathy. Let's say those in low socioeconomic areas all across the world, like impoverished, poverty, third world communities. Well, guess what? Some of them may not, a lot of them won't have the technology to transport these effectively. They'll have to use other viral vectors in order to confer immunity to their population. And so I guess it is a privilege to be able to live in a society or a country or a state, if you do, to be able to have access to options. The fact that we can even consider this versus this, I want to at least illuminate that. I guess that's something to be grateful for. I think, options are good, flexibility is good. Do you want the Big Mac, or do you want the cheeseburger, or do you want to go down to the supermarket or the Whole Foods store and make yourself a fresh, locally caught something, right? We got options here in this society, which is nice. So just some considerations, I guess, for other people who don't have as many. So let's make the best decision with what we have access to, in my opinion. So here we have adverse events. What we're seeing, Bell's palsy has occurred with Moderna. After second dose vaccine, clinical symptoms were moderate to severe, facial swelling, and on the left we see, the classic pain swelling, redness, fever, chills, lymph swelling, arrhythmia, and then we see with the adenovirus, we see a bit more myocarditis, heart inflammation, and so each viral vector has its own symptomology, related to it. But let's get down to what this is what we really came for, okay? This is a head-to-head comparison of the frequency of adverse events between Pfizer and Moderna. What we see in the orange, Moderna, it's very clear. You can be a baby and look at this and be like, what's bigger, orange or blue? Orange. Well done. Here's a lollipop. Moderna clearly stacks up to have a higher adverse event frequency compared to Pfizer. Check. Got it. Now, if you just say that statement, you might freak out. Risk is relative. So we need to then apply a relative risk across the x-axis. We see a percentage of effect, and we see lymph swelling, 20%. It's apparently this is it's not uncommon amongst general vaccines to see lymphs swell. Vomiting, nausea. It's a terrible feeling. They put these together. They put these two together, unfortunately. But vomiting and nausea, nausea usually comes before vomiting. So we see about 23%. Where Pfizer, you see very rarely do we see vomiting and nausea as a result of the Pfizer vaccine. But Moderna, we're seeing it considerably higher. So if you're like, I hate vomiting more than anything in this world, then maybe you get the Pfizer. Okay? I hate vomiting, but not almost than anything in this world. Man, how long has it been since I vomited? Jeez, it's been a long time, right? If you can get away with 10 years without vomiting, I think that's a big win. You've avoided food poisoning, water contamination. You're doing a pretty good job. It's pretty gnarly feeling when to have the acid be ejected out of your stomach with bile and chyme into, I hope this description is really nice for some people. Probably clicking off the video around now. Anyway, that's what vomiting is, guys. Don't know if you've heard of it. Anyway, arrhythmia, site injection pain, whatever. I think that's a whatever. If you're really stressing about injection site pain, maybe the virus isn't your biggest problem. Swelling, similar. Fever, very similar. Joint pain, a little bit more, 20% more. Yeah, that's important. People who exercise are going to feel a little bit more pain potentially when they're exercising. They may ameliorate their ability to exercise. Chills. No one wants to feel chills. They can keep you up at night. 45% versus 30%. Muscle pain, 61%. So yeah, muscle, the muscular, how should I say? The muscular system appears to be a little more affected here. and the skeletal system. Headache, slightly more. Fatigue, pretty similar. And pain and injection site, pretty similar. So really, we're just looking at the nausea, the vomiting, the joint pain, the chills, the muscle pain, and the headache being a higher relative risk. They're cited from 3 different CDC links that you can see below. And this makes sense considering the dosage is 3 times. So now we finally got into the question after all this time. What do you do? Well, I can't tell you what to do. I got clients asking me, what do I do? I'm not going to tell you. It's not up to, I don't think it's fair for anybody to say what you should do. I think the individual should come to an informed decision themselves. We need to practice critical thinking. And in order to practice critical thinking, you don't just give people fish. You tell them how to fish. You show them how to fish. You show them how to think. You show them how to ask questions. You show them how to be skeptical, but not so skeptical that you're cynical, but not so optimistic that you're naive. You do your best to try and swing back and forth and argue for yourself and against yourself, and that, hey, maybe there's a lot of adverse events that aren't being reported. I got health professionals and colleagues that I trust and love and get along with, and some of them are like, this could be a reality. So I want to also acknowledge that side. It's very hard for me to tell how much is being misappropriated, but I think if you just apply maybe a blanket, the data might be like 20% off on like everything. If you have like a buffer for like 20%, like maybe adverse events are not, maybe these if you apply 20% here to be 100%, that doesn't make sense relative to what it is, 20% of 80, for example. Like if you just give yourself a little bit of a buffer, it's an arbitrary number, it really doesn't matter. If you give yourself a little bit of a buffer of like, this could be a bit off here, and then you compare it to the alternative, which is virus without vaccine, virus with vaccine, you just make up your own decision based on the information you have access to and the mind you have and ability to think. So, look, this is the conclusion after, a lot of time digging through PubMed and different scientists and professionals to try and find more information on the relative risk differences on adverse events between the Moderna and the Pfizer and the efficacy differences. This is what we come to now. In summary, the Moderna does appear to confer a higher relative amount of adverse events. Most of them appear to resolve within 3 to 5 days. The Pfizer appears to present measurably less adverse events. And for those who are not concerned about lower efficacy, may choose to opt for Pfizer. Those who do care more about overall protection and efficacy and are not as concerned with the adverse events may choose to pick Moderna. I'm just kind of giving a thought experiment now of like, if this, then that, if this, then that. And so it all depends on your tolerance and risk for acute and systemic, but seemingly short-term adverse events, and how much you want to be overall protected from the virus, the boogeyman. I hope you guys found this valuable. I'm Alexander, Strength of Saad. All links below if you want to see more. Thank you for watching, and I'll see you next time.